Hello, everyone. It's Friday, September the 9th. We have lost an additional 21 folks since the last time we were here. I ask again for your respect and honor for these great West Virginians that we've lost. If I could read them, bear with me, but please keep them in your prayers. The 7,302nd person to die in West Virginia is an 81-year-old female from Kanawha County. The 7,303rd death is a 68-year-old male from Marion County. The 7,304th death, a 49-year-old male from Raleigh County. The 7,305th death, a 69-year-old male from McDowell County. The 7,306th death, a 75-year-old male from Logan County. The 7,307th death, an 81-year-old male from Monroe County. The 7,308th death, a 53-year-old male from Boone County. The 7,385th death, the 7,309th death, an 85-year-old female from Raleigh County. The 7,310th death, a 55-year-old female from Roane County. The 7,311th death, a 76-year-old male from Greenbrier County. The 7,312th death, a 93-year-old female from Marshall County. The 7,313th death, an 85-year-old male from Cabell County. The 7,314th death, a 70-year-old female from Mercer County. The 7,315th death, an 80-year-old male from Cabell County. The 7,316th death, a 92-year-old female from Putnam County. The 7,317th death, a 91-year-old female from Kanawha County. The 7,318th death, a 65-year-old female from Greenbrier County. The 7,319th death, an 87-year-old male from Kanawha County. Here's a very young person. The 7,320th death, a 43-year-old female from Mason County. The 7,321st death, an 85-year-old male from Wetzel County. The 7,322nd death in West Virginia is an 88-year-old male from Barber County. We have 3,058 active cases in West Virginia and 1,099 new positive cases. Our daily percent positivity rate is at 7.75 and our cumulative rate is at 8.52. We have 580,000 plus that have recovered from this terrible pandemic and 305 that are hospitalized at this time, 57 in the ICU units and 12 on ventilators. And we have 9 gold counties in West Virginia right now. That part's not good. I've told you about the Omicron booster shot. It's available to individuals 12 and older. As provided we've got the vaccines, we're getting vaccines in, I guess, pretty much every day. Maybe General Hoyer can tell you more about that in just a few minutes. But I highly recommend we're going to start with the 65 and olders, and I highly recommend in every way that you absolutely get this shot. And your vaccine calculator, if you're into the vaccine calculator, can assist you in keeping you on track. And so register, please go on our website and register for that, please. All of our numbers continue to improve, slowly, but we're now at 91.8% of the 65 and olders that have gotten at least one shot. It's better. It's better. The 18 and olders, or the 18 plus right now, the fully vaccinated numbers at 63.3%, fully vaccinated. So that's better. Still could be a lot better than that, but that is better. I've told you about the vaccine calculator and the vaccine info line. All that's up on our website. We have 109 long-term care facility outbreaks that we have right now. We have none in our church communities, 47 inmates and 23 staff cases. The inmates and staff cases have dropped considerably, and that's good. And again, thanks to corrections. We appreciate all you're doing. The Homeowners Assistance Program, I've told you a bunch of times about this and everything. Take advantage. All you got to do is call us and see if we can get you qualified. If we can get you qualified, it may very well be able to really help you. I've told you about giving blood and how important it is and how much the Red Cross needs you, how much all of us need you. Check with your physician, and if you can do it and everything, you got to go ahead from your physician. Please give it some consideration. The National Hunting and Fishing Days are September the 10th and the 11th, and they're going to be held at the Summit at the Bexel Reserve at Glen Lynn. It's a Boy Scout camp and everything. Lots and lots and lots of activities going on there for kids and everyone. It ought to be something that you really ought to take time to take a look at this. You'll have a lot of fun. It is an amazing sights and everything. There's everything from wild game cook-offs to on and on and on. It's a really neat experience. So consider that, please. And here's something that is so long overdue in my mind, it is off the chart. But today, today we're going to, I'm issuing a proclamation, in regard that actually it's going to be tomorrow. But Bob Huggins is finally being inducted or going to be inducted into the Hall of Fame. It is unbelievable. He has 916 wins in his career. And he's been an incredible basketball coach for WVU for a long time. And Coach Huggins is a really dear friend and an absolute unbelievable basketball coach. So many times it's taken us way down the trail, in the NCAA tournament. I know a lot about basketball. I've coached it forever, and I really admire what a great job this man's done. I absolutely just flat love it that finally we've come to our blooming senses and put this man into the Hall of Fame. I mean, he is a legend, and I'm really proud to say, just the other day, we were with Jerry West for a good while. Jerry's a great friend, and two great legends are going to present Bob Huggins as a Hall of Famer, and those legends are Jerry West and Rod Thorne. Really good stuff. So here's our proclamation, and Coach, we're so proud of you and so happy that finally, the people came to their senses and put a man in the Hall of Fame that is so deserving. And I'm sorry you had to wait so long, but congratulations ever, Coach. Really proud, really proud. Proud more than anything to call you a really good friend. Okay, I have issued a proclamation officially declaring that Sunday, September the 11th, is West Virginia Heroes Day. The flags will be lowered to half-staff on Sunday, and this day is in remembrance of the terrible events that took place on 9/11 on September the 11th, 2001. But with all that, we should always take time to recognize all of our heroes, all those that have run to the fire, all those that have absolutely, especially through this terrible pandemic, that have stepped up and really done any and everything they could to protect us, to save us, to absolutely get us through this. And so with all that, a proud day and a proud proclamation for me that, as Sunday will be West Virginia Heroes Day. Along with that, we lost a dear friend, Queen Elizabeth II. 96 years old. What an unbelievable life. I mean, can you just imagine all the different things that she experienced through all of her reign, but through her entire life? And so many will absolutely mourn her all across this globe. And we're surely ones of them. Kathy and I join in our deepest condolences for the loss of this great lady, this great leader that will absolutely be admired for decades and centuries to come. So in honor of Queen Elizabeth, I am ordering that all United States and West Virginia flags, come to half-staff, continuing through from now through the sunset of the day of her funeral. It's hard to transition from losing an incredible hero or all the great work of all of our first responders and everything in West Virginia Heroes Day, 9/11, an event that has scarred all of us that we'll carry to our graves no matter what. It's a happy moment for Coach Bob Huggins and everything. It's hard to transition all across the board here. The next thing I have here in my notes is Amendment 2, and the opposition that's come out. That folks that are opposing Amendment 2, whether they be the West Virginia County Commissioners Association, or they be our Commissioner Leonhardt, Agricultural Commissioner. From my standpoint, it's just as simple. It's just as simple as this. I truly believe that our counties, local control, our counties always have it better than we probably have it in Charleston. And from the standpoint of taking away their income stream and saying, we in Charleston, as your big daddy's going to take care of you. He's going to take care of you no matter what. It'll all work out. Well, just let's be really fair. Before I got here, we thought it was all going to work out. And yet when I got here, the only thing we could do is cut. And we'd been doing that for years and years. Governor Tomlin, before me, had experienced year after year after year of more and more and more cuts. It's all you could possibly do. You had to balance the budget, and even the first year that I came in January, and the year's half over, and the first words to me is, oh boy, we got a real mess. We thought we were in balance, and everything, and we were going to balance the budget when we put this thing all in motion last June 30. But Governor, through that time, we've not come up with anywhere close to the monies that we thought we were going to come up with, and we're going to be $217 million short in the year that we're in right now. Not now, when I first walked in the door. And then on top of that, Governor, the very next year, we're going to be another $497 million short. And then after that, Governor, it's going to blossom to $772 million short. Well, honest to Pete, I don't care if you're running this state or you're running a business or whatever it may be. Dupe happens. It just does. And when it does, you've got to deal with it. Well, in all honesty, our counties right now have an income stream that's coming to them, and they manage their businesses and help, with the schools and the, EMSs and the fire departments, the police departments and everything else. And all of a sudden, if that's gone and we say, oh, we're no problem, we're going to take care of you, everything's going to be all good, Charleston's going to take care of you, and then what if? What if dupe happens? Then you're going to be right upside down all over the place because they're not going to be able to help. So from where I stand, it's just as simple as that, combined with the fact that, a machinery and inventory tax, elimination sounds great, doesn't it? It sounds great to say, oh, we're going to have all these businesses that are going to come, and everything's just going to stay just perfect. Well, let me tell you 2 or 3 things. One is I've been at this now 6 years, and we've recruited a bunch of great businesses that have come to West Virginia, whether they be Nucor or Green Power or whatever it may be. All kinds of stuff, and all kinds more people are wanting to come. Pure Watercraft just came. We have an announcement that's right around the horizon that is bigger than big. Now, with all that being said, do you know how many people have asked me, have come to me, called me up on the phone and said, Governor, we'll come to West Virginia if you get rid of that machinery and inventory tax? None. Zero. Now, on the other hand, if things would happen to turn just a little bit bad and everything, in my book, what we need to be doing and what we need to be all about doing in West Virginia is one thing and one thing alone. We need to put our tax dollars that are not Charleston's tax dollars back in the pockets of hardworking West Virginians when we can. We can right now. And to put those dollars back in the pockets of hardworking West Virginians, it needs to be done with a personal income tax reduction. That puts money right back into our workers' pockets. when we get rid of something like the machinery and inventory tax, who's it going to help? Big companies, big companies. And many of them are not even West Virginians. You know, many of them are out-of-state ownership. Now, with that being said, you know, sure, I want to do everything, but you can't do it all. There's no way. There's no way in the world, if we end up passing a machinery and inventory tax, there is no way that you could ever do the personal income tax at the same time. Can't do it. No way. I don't care what anybody says, I'm right about that. Now, with all that being said, I want to put the money in the pockets of our people. Others want to put the money in the pockets of big corporations. It is risky to our counties if we have a downturn. I join in this effort wholeheartedly, and I think it is a big mistake if we go any other way. Last thing I've got is the home and community-based services increase in payments. I give Secretary Crouch a whole lot of credit on this. I'm going to read this. Due to the critical need for home health care workers of West Virginia, of West Virginia's most vulnerable residents, I have directed DHHR's Medicaid program to redirect federal funds to increase rates for our home and community-based services. These providers have stepped up to make sure our citizens can get the care that they need, and we appreciate them, and especially we appreciate them during this terrible pandemic. And Secretary Crouch will tell us more, but the bottom line to the whole thing is just this. Secretary Crouch, through a lot of really hard work, they have been able to find dollars that we can increase absolutely the dollars that are going to the home healthcare workers to be able to provide assistance and help to our folks in West Virginia. And we really need to do it because we need those people really, really badly. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor has read, we still have too long a list of West Virginians who have passed from COVID-19. In the U.S., yesterday we had over 650 people die of COVID-19, and in relation to airplanes, that is more than a 747 jetliner full of people. So we can't be complacent over COVID. And as the governor also said, the new Omicron COVID booster shot is out. I know General Hoyer will make some comments about how people can find that, but it is important for us to consider getting our up-to-date booster shots or COVID vaccines where we can. We know that that protects people who get COVID. We also know that that reduces the risk of long COVID. And speaking of long COVID, there's some more exciting work that's coming out that starts to identify areas of opportunity for us to define what long COVID really is. And it turns out that people with long COVID, at least in one study, had persistence of response against the spike protein of COVID-19, leading to the possibility that there may be an ongoing stimulation of the immune system during long COVID. We also know that small blood clots can also be important in the problems that people suffer with long COVID, and also that our immune system is also dysregulated. And it looks like that our anti-inflammatory system, the system that reduces inflammation, may be suppressed during long COVID, because one of our key measures of that, our cortisol level, which tells us about the amount of the anti-inflammatory, the endogenous, the body's own produced anti-inflammatory drugs or substances that are produced, are really low in long COVID. It also says that perhaps the stimulus from the brain that tells these anti-inflammatory substances to be made may not be working as well long COVID. So we're starting to get a picture of long COVID that maybe long COVID is a hyperimmune response to a persistent level of COVID-19 that the body is recognizing. We don't think that people that have this are infectious to other people, but that low level of persistence of the virus might stimulate the immune system to cause all the problem. The last reason why we should also continue to be careful is a new study that's out on looking at really, really sensitive heart tests and looking at people that even have had mild or moderate COVID-19 and found that using these MRI scans, the really advanced kind of imaging scans of the heart, that the heart looks like it may be inflamed in a lot of people who've had COVID-19, even after the fact. And in people that have symptoms, particularly, this study found that there was some inflammatory heart issues, at least on the scans. And the authors of the study recommended that if you do have shortness of breath or any kind of problem after COVID when you exercise, that you not push yourself to do more, but maybe talk to your physician to see if perhaps that problem could be related to an impact from the viral infection. Thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to reinforce a couple things that the governor and Dr. Marsh have hit on. Number one, anyone over the age of 12 who has received at least their primary series and is 2 months past their last shot is eligible for the COVID-19 Omicron booster. If you listen to the 21 names or 21 individuals and their ages that the governor read out that we just lost, great West Virginians, again, the ages over the age of 50 are the most vulnerable. So we really encourage people over the age of 50. 97% of our deaths are made up of people over the age of 50, and 75% of those over the age of 65. There is some inconsistencies in deliveries, as we understand it throughout the state. They may be dependent upon when a pharmacy or an entity ordered under the ordering process, or just some inconsistencies in the federal pharmacy delivery system. But the best way to identify where to get a vaccine is go to Vaccinate.wv.gov, go onto our calculator, which is considered one of the best sources in the country to be able to provide information to citizens. Go on there, put in the zip code, or if you prefer, call the hotline information line at 1-833-734-0965, and those individuals running that hotline will help you identify a place near you to get that vaccine. As the governor also pointed out, our hospital numbers continue to stay and hover around that 300 mark, bounce back and forth. We know after the Labor Day holiday, we were going to see 2 to 3 weeks out that those numbers would potentially surge. Even though that is not the 500 number that we are watching on a regular basis, any numbers to that level over 300 are going to create strain on our healthcare providers and our system. So please consider going out and getting that booster shot soon. Thank you.
All right, thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Thank you, Jordan. Good morning. As the governor mentioned, we are going to increase payments for home and community-based services. I thank the governor for helping to make this happen. These are important, crucial workers to our vulnerable populations throughout the state. These dollars will help recruit and retain the workforce serving home and community-based services and provide the needed care for West Virginia's senior citizens and individuals with disabilities through programs including those utilizing the Age and Disabled Waiver intellectual and developmentally disabled waiver, and children with serious emotional disorders waiver. We're directing that a minimum of 85% of the funds that we provide be passed to the direct care workers as increased wages and benefits. Provider agencies will have until March 31st, 2025 to expend these funds. We want to thank those workers and these agencies who perform these critical needed services for our clientele throughout the state. DHHS Bureau for Medical Services will seek approval from the U.S. Centers for Medicare and Medicaid Services, and we expect to implement this program by October of this year. So thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's for General Hoyer. Do we have an idea yet how many shots we've given out? And do we have any plans to add the new bivalent shots to the dashboard? I know there's the people with a booster shot number. Those are the old shots, the new ones. Are we going to break them out in the future? Thank you.
General, please.
Yeah. Yes, sir, Governor. So, Charles, the Omicron booster, it's going to be probably another week to 10 days before the flow of information coming from the various sources will give us a good indication about how many shots with that Omicron booster have been given out. And we're going to look to see how best to depict that going forward. As you can imagine, when you get into primary series, 2 boosters from the original piece, and now the Omicron booster going forward, we want to be able to depict that in a way that is not confusing. So more to come on how we will work through that going forward.
All right, thank you, Charles. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, as you know, there's a lot of money available for highways work. And what I wonder is if the legislature still needs to take a step to allocate some of the money available from the federal government, whether it is from the infrastructure plan or the American Rescue Act plan. And also with West Virginia's own budget running surpluses consistently, is there any thought of using that money for infrastructure like highways? Thank you.
Brad, the answer is this is an easy one for me because I have been, we go back to Roads to Prosperity and we go back to the first state of the state, and I believe wholeheartedly that I believed it then, I believe it today, that the number one thing we had to do in West Virginia to start on a pathway of changing our image was make education our centerpiece. The number 2 thing we had to do was we had to repair our roads, and we had to build new roads, but we had to repair the roads that we have, because the two things that businesses all across this land look at first and foremost when they're considering West Virginia is just one thing and one thing alone, and that is, where are my kids going to go to school? And the second thing is, how are the roads where I can get around? And really and truly, at that time, we all know what the situation was. The roads were unbelievably bad. So we've done a lot of stuff, have we not? And everywhere you go, there's orange cones all over the place and everything, but there's still more to do. And to answer your question, whether it be surplus dollars or it be CARES money or it be American Rescue money or whatever it may be, the answer would be just like you go into a restaurant and the waitress comes up and says, sir, do you like your eggs scrambled or fried? And the answer is yes. No question whatsoever, the answer is yes. We need to do more. And absolutely, you'll be seeing that real soon. I don't think we need to disclose that right at this moment, but you will be seeing more of an effort from my side and hopefully more of an effort from the legislature side. They've been great in following suit and helping, to really make a real commitment to continue to do things, anything and everything we can to make more and more and more repairs, especially repairs to our secondary roads, the roads that really are the functional roads to our communities. You know, I don't know that we'll be putting money up and everything to do a bunch of interstate work at all. I don't really see that need right at this time and everything. We've got lots and lots and lots of projects going on with the Roads to Prosperity program. And the net of the whole thing is we've still got more work to do. We want to push, you know, Secretary Riston and all of his great men and women and everything. They've done unbelievable work. Jimmy has been a superstar beyond belief and everything. We want to continue to fund the very, very, very maximum amount of work that they can get done and accomplished, you know, throughout the paving seasons. And so yes, I am all in, and I think you'll be hearing from us real soon. There's more and more and more to come on just exactly that, Brad. But great question. Thank you, sir.
All right, thanks, Brad. Next to Steve Adams with Ogden Newspapers.
Saving the best for last. This is Steve Adams of Ogden Newspapers here, and I'm not going to ask you to rehash what you just said about Amendment 2. I asked you about that earlier this week, and I think you had laid that out pretty clearly. But as I alluded to when I asked you about that earlier this week, I know you've been a supporter of it in the past. In 2018, you actually had made this part of your state address, trying to get rid of the machinery and equipment inventory taxes as part of your just cut taxes and win program or initiative that you tried to push that year. And there was a resolution, Senate Joint Resolution 9, that was introduced on your behalf to do just that. It didn't end up going anywhere that year. And of course, that's a big difference between what's being proposed in Amendment 2, which is 6 categories of tangible personal property tax. But even in 2018, you had said in your state you thought if you just eliminated those 2 types of tangible personal property taxes, you'd be able to protect counties and county school systems and those revenue streams. What's different, other than the number of taxes we're talking about? What's different now between your stance then and now? Thank you.
Well, Steve, it's really simple. I mean, if you just step back and think about it, I would like us to get rid of, I would love for us to be able to get rid of every tax period. You know, that's all there is to it. You know, from the standpoint of then and now, you know, we now know that we are struggling still to really bring population growth to West Virginia. Well, how are we going to bring population growth to West Virginia? Well, I mean, it's so simple, it's unbelievable. The personal income tax has all the sex appeal to bring population growth. We need people in West Virginia. We need workers in West Virginia. We need absolute folks in West Virginia to be able to prop up and help from the standpoint of carrying the load with our schools. We need young families to come to West Virginia. Now, with all that being said, I really, in all honesty, probably never thought it possible to really get rid of our state income tax in its entirety. I absolutely believe it today. It's really different. I mean, was it a possibility at that point in time in my mind? Probably not. Really and truly, am I absolutely a supporter from the standpoint of getting rid of any and every tax we can possibly get rid of? I am. I totally am. From the standpoint, am I a supporter of maybe doing something, you know, with the personal income tax and absolutely, you know, also being able to do something with eliminating our vehicle tax or our motor vehicle tax and everything and doing it together? You know, absolutely. Have I said over and over that I'm willing to compromise on it in every way? But Stephen, the bottom line is just this and only this. You can't do them both. You can't do them both at the same time. You can't do them both right now for sure at the same time. There's no way. You know, the numbers in the state today do dictate an absolute possibility of being able to get us on a pathway and mind the store, take care of the store, and get us on a pathway to get rid of our personal income tax. Now, Stephen, anybody, and everybody that absolutely logically and reasonably looks at this, you're going to come up with exactly the same thing. If the state of West Virginia has a way to reduce its income tax, it absolutely goes directly to the pocket of the workers. If we do a machinery and inventory tax, it is build a field and they will hopefully come. And absolutely the backbone of West Virginia, the workers, are semi-left out. Now, and why are we doing that? We're doing that, in my opinion, because in many situations, too many people, too many folks here are constantly running for the higher office or running for some level of re-election. You know, I'm not here to do that, Stephen. I've never been here to do that. But at the same time, really and truly, at today, how Jim Justice sees it clearly as it can be, today we have a real situation. We've got surplus dollars. We've got people that are fighting inflation like crazy. Absolutely, we should be giving back tomorrow. Tomorrow we should be giving back. Absolutely, we should be willing, all of us, to compromise and work together for the better good of all. I am willing to do every bit of that. But today, Stephen, of all things, today, we have the ability and the chance to get on a pathway of reducing and getting rid of our personal income tax. You can't possibly be serious. No one can be serious to not think that that absolutely will drive real live instant growth to this state. The state that's located them the closest to two-thirds of the population of this whole country, and it doesn't have an income tax. Stephen, I know I'm right about this. I am so right about it, it's unbelievable. At the end of the day, if we miss on this, shame on us, period. That's all there is to it. I am not driven for another office. I am not driven by stuff. I'm not. I'm just trying to tell you, I know this is the thing to do. Surely, to God above, everybody should know, is Jim Justice in favor of just tax? Of course not. Jim Justice would love it if we could get rid of our machinery and inventory tax and get rid of our personal income tax. You can't do them both. I never dreamed in a million years that you could get rid of your personal income tax in West Virginia, but I believe it now because I know it. I know it's a real possibility and a real opportunity right now.
All right, thanks, Stephen. Governor, back to you.
Well, I want to switch back to COVID because that's really the purpose of these briefings. I always want to answer any question that anybody comes up with on anything that I can possibly do. I think this number is correct, but with maybe a few more dollars that we're looking, Brad was able, his question was great and everything, but from the standpoint of if we're able to pump some more dollars into this thing, of which you'll be seeing real soon, I'm very hopeful that we'll get that done. I think that what we'll be able to do with our secondary roads is we'll be able to do paving this year of 1,000 miles. 1,000 miles in West Virginia, and that'll be really, really neat, really great stuff. I want to switch back to Dr. Marsh just a second, and because what an incredible man. I mean, that's all there is to it. But with all that, he warns us again about long COVID, doesn't he? And we should not just brush that away. How do we absolutely avoid long COVID? Well, if you want the best chance to avoid, get vaccinated. Get your booster shots. I mean, that's what the man is saying to us over and over. Long COVID can carry with it so many side effects for a long, long time. And literally, absolutely, there is the expert, our coronavirus czar, that's telling us and throwing up a red flag in lots of different ways, telling us all the different research that he's done, telling of that research and what we need to do. Long COVID. how it affects all the organs, how it affects absolutely the heart. You know, all long COVID with brain fog or whatever it may be. Long COVID, how do you avoid it? You got to get your booster shots. You got to get vaccinated. That's our best shot. Now, do we always want, and I always want to say this, we want to be respectful of everyone. But if people say, nope, I'm not doing that, I'm okay. I'm fine with that. That's their right, their freedoms, and this country was founded on that, and I stand rock solid right there. But it's my job to try to inform. It's my job to bring knowledge. It's my job to bring the very best of the best to tell us. And the best of the best told us again today, long COVID. You got to think about it. You really, really got to think about it. So with all that being said, I appreciate everybody. I appreciate all the great stuff that everybody's contributing and working on in every way, and the great questions we had today. So thank you so much. Let's all just keep pulling the rope together. At the end of the day, that's what we've done thus far, and that's what will get us through this. Thank you so much.